Hi, my name is Florence Ajayi Barnes, your virtual family nurse practitioner, and welcome to the Flo-Medical Show, where you get information you can trust. On the show, we discuss health, being an educated consumer, and you being your own best advocate. Disclaimer: this is valuable information, but please consult your healthcare provider. Let's get started. Today's topic will be hypertension. Why are we talking about hypertension? It's because nearly 1 out of 2 Americans in the United States, adults, are diagnosed with hypertension. That means nearly 116 million adults. Very alarming number. So, what is hypertension? Hypertension is when your blood pressure is elevated, or a condition in which the force of blood against your artery wall is elevated. What are the normal blood pressure readings? It should be 130/80 and below. Signs and symptoms. Most often, there aren't any signs and symptoms. And when they are, it's because the blood pressure or hypertension has not been diagnosed or left untreated. Some of the symptoms can be headache, shortness of breath, chest pain, nosebleed, or visual changes. If you experience any of those, please don't ignore. Seek the attention of your healthcare provider. What are some of the risk factors? There are 2 categories. We have the modifiable risk factors and the non-modifiable risk factors. What does that mean? Modifiable means risk factors that we can change. Non-modifiable is risk factors we cannot change. So let's talk about non-modifiable risk factors. Example of that, your age. The older you get, the higher risk of developing hypertension. Sex. In regards, males are higher incidence of getting hypertension than females. Ethnicity. African Americans or Blacks and Latinos are higher risk of developing hypertension opposed to their counterparts, the Caucasian and white people. Then you have family history or genetics. When you have a family history, you have a higher risk of developing hypertension. Not to say you definitely will get it, but the prevalence is higher. So then we're going to talk about modifiable risk factors. Modifiable are risk factors that we can change. The primary one is diet. So you follow a low salt diet. You follow a diet that is balanced, high in protein, high in magnesium and potassium, fruits and vegetables. Those are what's going to help you to decrease your risk of hypertension. Also, you have exercise, physical activity. That makes the heart beat faster and better so it can flow the blood to the organs where it needs to go. You also have obesity, being overweight. Overweight and obesity has never helped us. So being leaner, losing weight, make you healthy and allow you to have a decreased risk of hypertension. You have stress management, having a good night's sleep, drinking water, avoiding smoking cigarettes and drinking alcohol. These are all risk factors that we can modify, we can stop, we can change to decrease our risk of developing hypertension. So that's what you have with the modifiable and the non-modifiable risk factors. Treatment options. There's 2 categories for treatment options as well. You have pharmacological and non-pharmacological. Pharmacological is when we introduce medications, and non-pharmacological is the similar to modified, when we can change our lifestyle to decrease our risk of getting hypertension. So let's talk about non-pharmacological, because most people don't want to be placed on medication. So non-pharmacological is when we don't put you on medications, but we discuss with you about lifestyle changes. The same like the diet, exercise, making sure that you don't sit down in one place too long, you eat a proper balanced diet, you do stress reductions, drink a lot of water, you sleep. Those are things that we can change. Those are non-pharmacological approaches. Then we have pharmacological approaches. That's when you and your practitioner come together as a team and realize that the non-pharmacological approach is not working. So we introduce medication along with lifestyle changes. So together with that, that makes your prognosis of conquering or dealing with hypertension better. So, what are healthcare problems that are associated with developing hypertension? You could develop atherosclerosis. Atherosclerosis is when you develop fat or plaque along the vessel wall. That means that along the vessel, it's getting smaller, and the amount of blood that's supposed to flow through there, it's not flowing through there so it can go to the organs. You could also develop heart disease, kidney disease, visual changes, heart attack, and stroke. So just think about it. If you don't control your high blood pressure, a sequela of other problems can be developed. So it's important, don't miss the signs. It's important, don't ignore what you're feeling, and follow your healthcare provider's advice. And also, it's good to monitor your own blood pressure at home. So there you have it. You have great information that you can obtain, and great information that you know what you can look out for, information that you know it's treatment options. And we would like you to like, subscribe, and share this information with anyone you feel can benefit from it. My name is Florence Ajayi Barnes. Thank you for joining us at the Flo-Medical Show, and see you next time. Bye.